Diabetes and heart disease are two of the most serious health challenges we face today. The relationship between them isn't just a coincidence, it's a dangerous connection that can catch many off guard. People living with diabetes are at an elevated risk of experiencing heart problems, including heart attacks. Understanding the intricate link between these conditions can make a big difference when it comes to health and prevention. For many, understanding this connection is the first step to protecting their health and extending their life.
Before we continue, I'd like to tell you about Diasalon, a powerful blend of 13 natural ingredients, each carefully selected for their proven ability to support healthy blood sugar levels, enhance insulin sensitivity, and promote overall wellness. You can read more on Diasalon.com.
Diabetes affects the way your body handles sugar, causing high blood sugar levels that have far-reaching effects. This isn't just about sugar levels being out of whack. It's about how those elevated sugar levels begin to harm vital parts of your body over time. One of the main targets of this damage is the cardiovascular system. Excess glucose in the bloodstream starts damaging blood vessels and arteries, leading to a ripple effect throughout the body, like a series of dominoes that slowly fall, one by one. This damage leads to a buildup of fatty deposits in blood vessel walls, narrowing them and making it harder for blood to flow. When blood flow is obstructed, the heart starts to struggle, and, over time, that struggle can lead to serious consequences. Many people don't realize that having diabetes can double or even triple the risk of developing heart disease compared to someone without diabetes. Studies like those from the American Heart Association have shown this clear link time and time again. It's not just a question of heart attacks either. Diabetes can increase the risk of strokes, angina, and high blood pressure, all of which are closely connected to the heart. It's like being handed a map with several roads leading to the same treacherous destination. Some of these roads take longer to travel down, but if there's no change in direction, that destination, a serious heart event, becomes more and more likely. Many individuals with diabetes also deal with a series of additional risk factors that make matters worse. High blood pressure, cholesterol issues, and obesity often join the mix, creating a perfect storm for heart trouble. Each one of these risk factors on its own can put stress on the heart. When combined, they amplify each other, making the situation even more precarious. Imagine trying to hold up several weights at once. Sooner or later, the strain becomes too much. For the body, this strain often results in damage to the arteries, those critical highways that supply life-giving blood and nutrients. When they are compromised, it's only a matter of time before signs of heart disease start to appear. Inflammation is another piece of the puzzle, and it's one that doesn't get enough attention. When blood sugar levels are too high for too long, inflammation in the body increases. This inflammatory response is intended as a protective mechanism, but when it's constantly triggered, it leads to more harm than good. Persistent inflammation damages blood vessels, makes it easier for plaques to form, and weakens the heart muscle. It's like an alarm system that won't stop blaring. The constant noise starts to wear down even the best parts of the system. For people with diabetes, this type of inflammation contributes to both short-term issues and long-term health risks. The heart is forced to work overtime, and over time, it wears down from the relentless demands. Another crucial element in this dangerous link is neuropathy, the nerve damage that can accompany diabetes. Neuropathy is often thought of in terms of foot pain or numbness, but it can affect other parts of the body, including the heart. The autonomic nervous system, which controls involuntary actions like heart rate, can be compromised by diabetic neuropathy. When this system isn't working properly, it's more difficult for the heart to respond to changes in physical activity, stress, or even sleep patterns. This puts further strain on an already challenged cardiovascular system and leaves people more vulnerable during times when their heart needs to be adaptable. Lifestyle choices play a significant role in both diabetes management and heart health. Regular exercise and a balanced diet can help manage blood sugar levels, improve blood circulation, and reduce the risk of heart complications. Yet, for many, these lifestyle changes are easier said than done. When faced with diabetes, the challenge is often about managing so many aspects of health at once. It can feel like a never-ending checklist, monitoring glucose, adjusting medications, planning meals, scheduling workouts. It's no wonder that many individuals find it overwhelming. The truth is, though, that small, consistent changes can have a major impact. Walking for 30 minutes a day, for instance, or replacing processed foods with fresh alternatives can go a long way in reducing the burden on the heart. It's about building habits that lessen the load, one manageable step at a time. Stress, too, is often an underappreciated factor in this connection between diabetes and heart disease. Chronic stress raises levels of cortisol, a hormone that, when presented in large amounts for extended periods, contributes to increased blood sugar levels and blood pressure. It creates a feedback loop that places additional pressure on both the heart and the endocrine system. Learning to manage stress, whether through mindfulness techniques, relaxation exercises, or simply making time for enjoyable activities, can significantly impact heart health for someone dealing with diabetes. Every effort to manage stress better is an effort to lighten the cardiovascular load. What about medication? Many individuals with diabetes require medication to help control blood sugar levels, and these medications can sometimes impact the cardiovascular system too. Sometimes diabetes medications come with heart benefits, while others may have neutral or slightly negative effects. It's a delicate balance, finding the right combination of medications to manage blood sugar without increasing the burden on the heart. This is where doctors often play detective, trying different treatment approaches and adjusting as needed to provide the best outcome for both diabetes and heart health. Advances in medicine mean there are now options available that can help address both issues simultaneously, but each person's needs are unique. Regular check-ins with healthcare providers are crucial for navigating this balance. Heart attacks can often present differently in people with diabetes compared to those without. Classic symptoms like intense chest pain may be muted or even absent, replaced instead by subtle signs like fatigue, shortness of breath, or discomfort in other areas of the body. This phenomenon, often referred to as a silent heart attack, is incredibly dangerous. The lack of clear symptoms means that many people don't seek help when they need it most. This delay can result in much more severe outcomes, simply because the heart attack is left untreated for too long. Recognizing the less obvious symptoms and acting quickly can be life-saving. For those living with diabetes, it's crucial to understand these subtleties and to take any unusual symptoms seriously. Family history also plays a role in this connection. People with a family history of either diabetes or heart disease need to be extra cautious. Genetics can predispose individuals to both conditions, and when the deck is stacked against you, it's even more essential to take preventive measures. This means not just managing blood sugar levels, but also keeping an eye on cholesterol, staying active, and having regular heart checkups. Knowledge is power, and understanding personal risk factors gives an opportunity to act before it's too late. Now, here's something that many people don't think about, yet it might be the most critical piece of all: the power of consistent monitoring and staying vigilant. When living with diabetes, the body sends countless signals, small signs that something might be off, even before major symptoms appear. These signals can be changes in blood pressure, irregular heartbeats, or fluctuating glucose levels that seem out of place. Paying close attention to these signs is often what makes the difference between catching an issue early and facing a serious heart event later. Tools like glucose monitors, blood pressure cuffs, and even wearable fitness devices can provide valuable information. It's about being proactive rather than reactive, and catching changes before they become crises. The best part of all this is that there are actions you can take right now that genuinely matter. For those dealing with diabetes, the journey isn't just about avoiding sweets or sticking to a diet. It's about cultivating a lifestyle that protects your heart at every turn. It's a combination of being informed, making gradual changes, and staying alert to the body's needs.